There are currently 16 active cases of coronavirus in Victoria. There have been 2 new locally acquired cases notified to the department in the last 24 hours, and we'll go into the detail of those soon. There were 22,849 test results received today. That brings to over 4.6 million the number of tests that have been the test results that have been received throughout the pandemic. Before I get to the detail of those cases, which are the cases that the Minister spoke to yesterday, and the very strong public health response that we have put in place since, I first want to make some comments about these variations or variants of concern, these mutant strains. These are, as we know, highly infectious, hyper-infectious really, and it is a very significant cause for concern, not just for us, but I think for every government and public health officials right across the country. This is a wicked enemy made more challenging by the fact that it is changing. It's a moving target, and that really does cause significant concern for all of us. You've heard me speak many times about the fact that our reset hotel quarantine is the most risk averse. It is the most labour intensive. Elements of it are in fact now the national standard. But even then, with all of those steps, and can I say a willingness to do more where we need to, these hyper-infectious strains are proving very difficult to contain. And that's a real challenge, not just for today, but indeed for the weeks and months ahead as we move towards vaccinating the elderly, the frail, those who would be most susceptible to this virus. There's no reflection on any system. It's simply the fact, and we need to acknowledge it, that it's not a static enemy. It's wicked and it is changing. And that means that we have to redouble our efforts to do more and to respond to that unique challenge, a challenge that is very different than what it was a month ago, let alone what it was 3 or 6 months ago. So in terms of just an update on the matters that the Minister spoke to yesterday, so firstly, the second case in a hotel quarantine worker at the Holiday Inn, that person tested positive and is a food and beverage attendant at the Holiday Inn. She last worked on the 4th of February and tested negative at the end of her shift. She developed symptoms on the 6th of February. On the 8th of February, she was advised that she was a primary close contact related to the previous identified exposure at the Holiday Inn and was, as such, required to isolate and get a test. She got tested on the morning of the 9th and returned a positive result. During the time she was infectious, she visited a number of sites in the Sunbury area, and those are those Tier 1 exposure sites that we have listed on the website, and we would commend all Victorians, particularly those in and around that community, to be well acquainted with those sites. And if you were there during those times at those locations, then you're required to isolate and to get tested. The exposure sites will be added to or refined as information comes forward, and it really is critically important that people, if you've been at those sites during those times, you've got to isolate and you've got to get tested, and if you need any support or assistance, then obviously through the website we're more than happy to provide that. I have no further exposure sites to add to that list. If and when we do, then of course we will. We've so far identified 13 social and household primary close contacts linked to this case. Each of them have been contacted. They're isolating at home. There are several high-risk individuals within that cohort. Last night, as part of our rapid public health response, we arranged for them to be tested after hours, a special run if you like. 5 have so far come back negative, and the balance of those results should be available to us today. And as soon as we're in a position to update you, then we will. And I want to thank those laboratories and all the other people involved in that extra effort, if you like, to keep us all safe. Now, onto the case of a hotel quarantine resident at the Holiday Inn, the other case that was announced yesterday by the Minister. As was advised, this individual exited quarantine on the 7th of February and got tested out of an abundance of caution on the 8th, returning a positive result a day later. Interviews with that person have been conducted, and their close contacts and others have all been contacted. I should say there are no exposure sites. That person basically stayed at home so it'll only be family members and others. So that's quite contained, and we're very pleased to be able to report that. In terms of the very first case at the Holiday Inn, that is the authorised officer that we spoke to you a couple of days ago about. That person tested positive on the 7th of February. Current exposure sites are again published online. Anyone who's visited those, just as the Sunbury example, you need to isolate, you need to get tested. That's how we keep you safe, your family and every single family. We identified 8 household and social primary close contacts of that authorised officer, the very first Holiday Inn case. 6 of them have so far tested negative, and once we get the balance of those tests, again, we will update you. Finally, just in terms of cases, the family of 3, who are 3 of the 6 cases linked to the outbreak at the Holiday Inn, this family was residing in hotel quarantine as hotel quarantine guests, not staff, but as hotel quarantine guests. We believe that the transmission of the UK strain occurred prior to them entering Victoria. 2 members of this family remain in hotel quarantine with our support, and 1 member of that family has been moved to hospital. That person is dealing with some very significant health challenges, and we wish them well, and we again take this opportunity to thank staff for the outstanding care that they provide. The Chief Health Officer will speak to our working theory and evolving theory in relation to contributing factors to transmission in just a moment. But before I do that, I want to make a couple of important announcements. As a result of this outbreak, the Holiday Inn at the Melbourne Airport will be closed for a terminal clean. So that's that very deep clean to the highest of standards, and it's simply not possible if there are guests at that hotel. I wouldn't read any more into that beyond the need to do that clean, and you simply can't do it if there are people there. So that'll be done as quickly as possible. Those guests have and are being moved to alternative hotels. That'll be done safely, but that what's called a terminal clean, the clean that would normally happen after guests had left, that's being done across the entire hotel, and that's again through an abundance of caution. Also, anyone who has spent time in the facility, any more than 15 minutes in that facility, between the 27th of January and the 9th of February, worker or resident or visitor, for whatever reason, is now considered a primary close contact of this outbreak and will be required to isolate for 14 days and to get tested.